with systemic steroids, but still it's a very promising treatment.
I think the live streaming went on and off while you were giving your answer. Would you mind just saying again what you think about the game-changing effect of dupilumab in bullous pemphigoid from the recent
I think
trial?
that I think that it seems to be an effective treatment, a safe treatment, a steroid-sparing treatment. It it might help all of these elderly patients who are um, really suffering from the deleterious effect of systemic steroids. But of course, it cannot be monotherapy for all the cases. I mean, it should be, at least at the beginning, I think, combined with lower dose of systemic steroids. So it will be a game changer. But we need more data. We need to try it in more cases. But still, it's a very promising one.
Mm-hmm. Great. Jose, do you have any personal experience from the trial or from using dupilumab in any of your complications?
Yes, we had experience. We have treated maybe more than a dozen patients in my department, and we recently published a retrospective study of all Spain, more than 100 patients, and we had really very good results. So the impression this is it's probably the future, because it's a medication where we are familiar, because we are using in atopic dermatitis. It's very safe and convenient for the patients, and I think it's probably the future, because we want drugs that are safe and effective in this type of population. I had some patients who relapsed, but anyway, the I think the treatment really works, and this has been shown, as you brilliantly show in your presentation with the clinical trial, that really I think the results in real life are better than the clinical trial. That's my impression.
That's
that
interesting.
happens that happens many times, that clinical trials are so restrictive. Then and with many treatments we have better results in real life.
Yeah, I've had a wonderful fellow with my department from Ireland, and she had experienced this poor lady in Dublin who was stuck in ICU for nearly 6 months and had tried rituximab, IVIG, methotrexate, all these cytotoxic drugs. And in the end, this BP patient only responded to a combination of omalizumab that she was already on but not fully responding to as well, and dupilumab. And with these agents, this patient was able to get off all the steroids and these other toxic drugs that hadn't worked. And then it was the addition of the dupilumab that finally got her better. And she was a really severe case. And it's just been published. I mean, as you say, in trials, we get what's left of everyone who doesn't have other complications. But in real life, the patients that we have are those with all these other problems.
Mm-hmm.
Did you have any further comments for the audience? Because at this time, there's no one asking tricky questions of us.
No, I don't really have any question. I think all the presentations were great. The sound was not great at first, but then it was perfect, so I could follow all your presentation, and also Frederic's and Pascal. They were a very nice presentation. I think there was a very nice symposium.
Yes, and I think people in Africa can't travel very easily to other places, and then to have to pay money to listen to educational talks. It's unique that this is all free for them, and quite tricky that Ibrahima has had to put all these great international talks together for people to be able to listen to with low budget. You know, it's pretty amazing to me. And I'm really grateful to you for giving up your time today at your busy jobs and being available to record these talks and then be there to answer questions. And we will be receiving questions after the fact, and we will be able to respond to them by writing replies, I understand. So thank you for coming, and hopefully next year we'll have the streaming part of this will be more smooth. But thank you again, my friends.
Yeah.
Thank you very much, Zede, for the invitation.
Thank you for organizing together with Ibrahima Tauri.
Thank you.
Have a nice day and a nice week.
You too.
Bye-bye.
You too.
Bye-bye.
Bye-bye.
Thank you.
Bye.